Good morning, everyone. We're starting a few minutes late, but
My fault, apologies. I had a Halloween Montessori refusal and it was very stressful.
scarier than Halloween.
I know.
Thanks very much for coming. Listen, just welcome everyone. I'm just doing a very quick welcome. My name is Fiona Moriarty. I'm the breast cancer nurse counsellor here for anybody I haven't met already. I don't think I'll ever get over the joy of seeing people on site, after the last few years. So it's lovely to see so many of you here. And I suppose it really reflects the need for specific, good research-based information of how to manage menopausal issues after a cancer diagnosis. I think what I'm certainly hearing in the House is, while everything is menopause at the minute, the national conversation is all about menopause, but I suppose after a cancer diagnosis, it's a little bit more complex. So a lot of the women I'm meeting feel a little bit left out of the national conversation. So that's why a day like today is so important. I suppose, I'd only be getting into talking about what's going to be spoken about, so I won't say any more. It's really great to have two very knowledgeable speakers come to us today and giving their time and expertise freely. We really appreciate it. Just a bit of housekeeping. So just if we can honour confidentiality in the room, so people feel fine. There will be time for questions and answers. You'll notice that there's a lot of equipment here. We are recording the talks. They'll be made available online, but none of the people in the room are in the shot, just to reassure you. But it'll be great to have this resource accessible for other people who couldn't be here today, and it'll be up on the website maybe from next week. Just there's toilets here. If you're uncomfortable, if it's too hot, we're trying to open windows. It's very hard to manage temperature, as you all know. We've lots of water at the back of the room. We've some people in the room here. They're volunteers. Helena's here. We have other people in the room. We've Emer Fenlon, who is running a pilot study here in the House. It's an OT-led program, especially looking at issues around menopause. So we're all going to be in the room. If anybody needs support, just come to us. We have a lot of supports in-house that, just come to us and talk to us and see how we can further support you. In your little folder, there are a couple of sheets just to take notes if you want. There's also a symptom checker that, it's one that we printed up ourselves, but it's based on all of the generic ones. But I think it's really handy sometimes if you're having issues to actually bring your symptom checker, rate how severe the symptoms are and bring them to your next consultation maybe. And it's just a nice tool to help. There's also a feedback form in the pack. We're always grateful for feedback, good, bad, and indifferent, because we can't shape our services unless you tell us what you need. So we would really welcome that. So I just want to also thank Rosh. Sorry?
Just that, to make sure that everybody has signed in.
Okay, and just, please. I just want to specifically thank Rosh because Rosh gave us some funding last year. We didn't quite use all of the budget, so we had some left over, so we were delighted to be able to use it today to have today's session recorded. And we've Colin in the back of the room there who's looking after all things IT. The other person in the room here today is Rachel Guerin. She is the CNS with the complex menopause clinic that's newly opened and works with Brenda. So it's really good to have a complex clinic opened now in Cork. So I'm just going to introduce Brenda and I'm going to stop talking then because we'll get into the meat of it today. Brenda is an accredited menopause specialist and a portfolio GP with a special interest in women's health and sexual health. She obtained her menopause training in King's College Hospital in London, which is a recognised tertiary referral centre for complex menopause care. Upon her return to Ireland, she established the Danu Clinic in 2020, that's in Mallow, which caters for all aspects of peri and menopause care. Her other roles include working as a GP within the gynecological department in Cork University Maternity Hospital. You're one of the two GPs working in the complex there. in the clinic. So, and training, she also trains peers to BMS standard as a menopause trainer, providing menopause education and training to GPs via the Irish College of Cancer of General Practitioners. So, like a wealth of information that you're and experience. So, thank you very much, Brenda.